Now, as the winter season is approaching, there are fears COVID-19 cases could once again be on the rise. The latest number of cases shows a slight uptick in infections compared to previous days. The cases have increased by over 4,000. The death toll has been in the single digits, but the NICD, that's the National Institute for Communicable Diseases, is warning that there may be a backlog in the mortality rate. Let's unpack these numbers a little bit more now with Dr. Michelle Groome from the National Institute of Communicable Diseases. Dr. Groome, good afternoon. First up, this uptick that we're seeing now, is it one that's causing some concern, or is it too early to say?
Yeah, so I think you're right. I think it's a bit early to say. I think we have seen over the last 2 days kind of increases in the number of cases, and maybe where we would have expected lower numbers after the long weekend. And we've also seen a slight increase in the percent positivity rate. So that's the number of positives out of the total number of tests that are done. And so we've seen slight increases in this since the beginning of April. And in terms of the positivity rates that are creeping up, this is mostly in Gauteng, KZN, and the Eastern Cape. But the hospitalizations are still at very low levels, as well as the deaths. So I think we are always just cognizant that we need to be watching what's happening with COVID. We're not kind of fully out of the pandemic yet, and so these increasing numbers are definitely, I don't think yet cause for concern, but we do need to keep an eye on it over the coming days.
Okay, you've mentioned the provinces of Gauteng, KwaZulu-Natal, Western Cape and the Eastern Cape, but I just want to zoom in a bit on KZN because of the floods that we've seen. And the story I've just done now with my colleague Lindsay Dentlinger talking about the health department expressing its concerns about disease, like waterborne diseases, like your choleras and E. coli related diseases that might happen in KZN. Could we see numbers there also being affected, the COVID-19 numbers being affected by the floods?
Yeah, definitely. I mean, we know 2 years into the pandemic, we know the situations which do predispose to increasing numbers. And I think with the devastation from the floods and with many people, having lost their homes and in temporary shelters, there is opportunity for increased transmission, if there are larger gatherings of people. So I think there definitely is room for transmission, but I think, we mustn't only be thinking of COVID in terms of KZN, and be watchful for many other diseases as have been described. But I think definitely be watchful.
Yeah, your peers in the health sphere, being in the government, were telling Parliament that as well. Same thing. Now, what about this thing that you call positivity rate? How is that happening in these latest numbers we're seeing? Is there an increase there as well?
Yeah, so there has been an increase in the positivity rate. So I think on Wednesday it was just over 13%. Yesterday was up to just under 16%. So we definitely are seeing increases in the positivity rate. I think the overall testing numbers have been low, and I think that's just many people may not be accessing testing. So I think at this stage in the pandemic, also difficult, or maybe a little bit more difficult to interpret some of the metrics when we don't really know who's accessing testing. So I think we'll watch this week whether the testing rate is also going up, but definitely the positivity rate does seem to give us an early indication of increasing cases. That's also been largely limited to KZN, Gauteng and Eastern Cape, and seems to be affecting all of the age groups.
Okay, so the numbers are going up a little bit, but not too much, causing too much of a concern. But of course, you're going to have to watch the trend. But we will begin to worry, as you said, if more people are testing positive, if they access testing at all, or if people start getting sick and being hospitalized. But Omicron, we're told, is fairly moderate and mild, or will any of its sub-lineages? I learned that new language the other day, that there's a sub-lineage to a virus. Should we worry that they might be more infectious and cause us headaches, or there's nothing really to panic about at this stage?
Yeah, so we have seen, I mean, the same as with Delta, that, the original form has many different, starts changing, and so we get these sub-lineages. And so with Omicron, we started, they usually are these BA.1, 2, 3, 4, 5. These are the sub-lineages. And so we saw the move from the BA.1 to the BA.2 earlier in the year, and now there is an increasing proportion in the ones that have been more recently detected, the BA.4 and .5. So there is a chance that, these lineages may be slightly more transmissible, maybe leading to increasing cases. We wouldn't really expect it to lead to more severe disease. So I think that's why it's important to keep a watch on both the cases, but and the hospitalizations and deaths. And I think, at this point we saw with the third wave, we had lots of cases, but relatively fewer deaths and hospitalizations. And I think we really are more concerned with whether we're going to be seeing increases in the hospitalizations and deaths. I think having increasing cases is not unexpected. We've decreased restrictions. There is increased mixing of people. We're going into the winter months. People tend to congregate more indoors. And I think also to be mindful that there are other respiratory viruses out there. With the restrictions easing, we may see viruses like influenza also playing a bigger part this winter.
Okay, just on that score, thank you very much, Dr. Groome, for bringing it up. Flu vaccines, flu jabs. Last year, I went for my flu jab as well, and they had 4 strains. Do you encourage, from the NICD perspective, that we still carry on with the flu jabs? Some people are saying, I'm vaccinated out, I've done the booster, I don't want any other vaccine. Would you recommend, though, that we still consider a vaccine against the influenza?
Yeah, so we know we haven't had a big influenza season over the last 2 years. It was also limited by the restrictions that we had for COVID. So I think definitely we may see a bigger flu season this year. Also, the elderly who are at increased risk and those with underlying diseases. So definitely need to get your flu vaccine. And while people are maybe, are tired of hearing about the vaccines, I think we know that this is the way we've managed to control many infectious diseases. And similarly, even now for COVID, if you're due for your boost and haven't been, I think, with these small increases, I think now is the time to either get vaccinated for the first time or to get boosted, and definitely get your flu vaccine if you're at high risk.
Thank you very much for that, Dr. Michelle Groome from the NICD.